A single drop of blood holds the secret to life. But what if the drop doesn't stop flowing? Good morning to Sir Amin and my dear fellow friends. I'm Nisharmal Marinutu. Today I will be speaking about hemophilia, a rare yet serious disorder that affects the body's ability to stop bleeding. It's a condition that has challenged the medical world for centuries, yet the advancement in science has given a new hope for the medical effect. So let's start the topic. Today's talk content introduction, type of hemophilia, causes and genetic, diagnosis, complication, symptoms, treatments and prevention. Introduction. Hemophilia is known as royal disease or Christmas disease. It's a rare bleeding disorder characterized by impaired blood clotting, leading to prolonged bleeding, caused by a deficiency of clotting factor, either it's a factor 8 or factor 9. Primarily affected males as it is linked to recessive. The prevalence hemophilia A is in 1 in 5,000 male birth, and also hemophilia B is in 1 in 25,000 males birth. Type of hemophilia. First, deficiency of factor 8, which is most common. Number 2, deficiency of factor 9, which is known as Christmas disease. Number 3, deficiency of factor 9, and also this is very rare. The causes and genetic. X-linked recessive disorder mostly are affected in male. And also, in these hemophilia cases, the female are the carrier mutation in F8 is a hemophilia A or F9, which is factor 9 hemophilia B gene. Now, let's see the symptoms of hemophilia. There is excessive bleeding from cuts or injury. There are frequent nosebleeds, easily bruising, joint and muscle bleeding, which is a hematorosis. And also, those who are infected, they have a blood in urine or stool. Now, let's see how to diagnose it. The diagnosis first is blood test. They will check the promothrombin in time PT test and activate the partial promothrombin in time APTT test, and also clotting factor assay, which is a factor 8 and 9. Genetic testing, complete blood count testing, also known as a FBC test, and fibrinogen test. Treatments for hemophilia. Factor replacement of treatment therapy, the infusion of missing clotting factors, recombination of plasma derived factor, descompression or DDAVP is used in a mild hemophilia A, and also gene therapy, which is a future potential. I've attached here the treatment's procedure. First, the plasma-derived composition of coagulation factor, the recombination of coagulation factor, the bispecific of monoclonal antibodies, and also the gene therapy. These are the treatments. What are the complications will happen once they are had hemophilia? First, joint damage due to a repeated bleeding. Second, the formation of inhibitor, which is antibiotized agent clotting factor, and the intracranial bleeding can be a life-threatening, which also it's lead a stroke. What are the prevention of hemophilia? To avoid a contact spot and injuries, regular clothing factor replacement therapy, and a healthy lifestyle. Have to go physiotherapy to protect the joints, and also genetic counseling for affected families. In conclusion, hemophilia is a serious and manageable condition. Through this medical advancement and proper care, individuals with hemophilia can live a normal life. Awareness and early diagnosis play a critical role in managing this disorder. I hope this presentation has given a clear understanding of hemophilia. Thank you to Sir Amin. I have attached a YouTube link here for more understanding. You can view this video. Thank you so much once again.